joining us again today here at Medicare Insurance Broker Channel. Today is February 18th. Not sure, might be towards the end of February 2021 here we're in when we get the video posted here. But we want to talk to you about COVID, coronavirus, and what's going on with that today.
Yeah, absolutely. We're happy to be here. So thank you for joining us. What we're going to talk about is the coronavirus. It's been changing, evolving since we last did a video when it first came out. Things seem to be tapering off, which is a good thing. Vaccination rollouts is happening. So yeah, we're excited here to kind of, we're not experts here, but we're here to try to help you understand the coronavirus, the vaccines, and the rollout.
Yeah, mainly we're getting some questions from our Medicare clients on vaccine testing, antibody testing, where to go, how much it's going to cost. A lot of different questions, so we want to help answer some of those through a video.
Absolutely. So we're going to talk about some different topics regarding the COVID-19. We're going to refer to a lot from the CDC guidelines, the carriers themselves, and yeah, there's going to be a lot of information we're going to be talking to you about with this video.
Absolutely. There's insurance carrier resources, CDC guidelines, and CDC recommendations, which is kind of, you know, what we should be going off of. CDC kind of has the final say here as far as what people can and should not be doing. I'm going to answer some myths versus facts against the virus. And what I'm going to talk about first is what people are Google searching. I mean, it's a good indicator of what kind of questions people have as far as virus questions go, and we're just going to go down the list here. Testing is top of the list. Antibodies, cost, hospitalization costs, reimbursement, Medicare Advantage plan, insurance. So obviously it's a concern of cost, insurance, and what all that comes into play there. Then vaccine. People want information on the vaccine and other medicines for treatment. Looks like, yeah, and telemedicine. So those are the top Google searches as of February 2021 as far as vaccines concerned and Medicare folks.
So let's talk about cost. I think that's important, an important piece for us to start talking about. So as far as we understand is that the COVID testing, anything related to COVID, there is no cost to you, which is very, very important because we get that question asked a lot by our Medicare folks, and there is no cost for the vaccination, no cost if you happen to get hospitalized. Don't worry, don't stress over it. The most important thing is to get yourselves back together well, and there's no cost when it's anything related. And here's a screenshot here that you see directly from Medicare.gov, and there's no cost to you for the vaccine or any cost related to the hospitalization.
Yeah, and I haven't heard anything different. I mean, the CARES Act that was passed last what was it, April or May, short of going through all of that documentation, I mean, the moral of the story is nobody's going to pay for any testing, treatment, or vaccines as far as coronavirus is concerned. So that was part of that whole CARES Act thing. I haven't heard from any of my clients about having issues, but whether or not you go through with, you know, going directly through the carrier, which I think is probably best if you're with a Medicare insurance carrier, or you go individually out on your own and go get your shots and treatments done outside the carrier. The moral of the story is I think that it's all covered under the CARES Act.
Yep.
And you shouldn't have any out-of-pocket costs when it's all said and done here.
So if you look here behind our screen, here is Anthem Blue Cross's site. We're not promoting any particular carrier. We just wanted to provide you some friendly information that you can refer to where to get tested. The thing that we want to get across in this video is that refer to your insurance carrier so that you know where you can get tested for COVID or where you can get vaccinated. Always go to your carrier's website to get that information. So here's an example of Anthem. If I enter just zip code here and 64106 zip code here, here in Kansas City, it should pull up to you pretty quickly. It has about 125 results here within 20-mile radius. And if I just scroll here, pretty nice website where you can see address, phone numbers, mile radius, and what types of services are provided at that particular location, if there's an appointment required. So it's very nice. I think it's helpful. And I'm not going to go through all this. Sorry if I'm going through a little too quickly, but you get the gist of where you can go get tested for COVID if you show any signs of coronavirus, and or go to where you can get your vaccination, right?
Yeah, we'll put the link for this one. Like I said, this is Anthem's link. Every carrier is going to have their own link for testing, but this one gives you a nationwide look. So it's going to pull up all of the local resources for whatever zip code you punch in here, as far as testing, treatment, and other items. So we'll have that link in there. We'll also want to include the links for the top carriers: United Healthcare, Blue Cross Blue Shield. We're in the Kansas City area, so we'll include that one. We'll include the Anthem link, Humana, Aetna. So we'll put all that information out there depending on what carrier you're with. And those links will be in the video below. By the way, while we're at it, make sure and like this video if you like this information so far.
Absolutely.
And follow our page for more information.
So here's the other thing. This is United Healthcare's site. I entered the same zip code, 64106. Has a different feel for it, but what I do like about the United Healthcare, it kind of gives you Jackson County vaccination information. It's a hyperlink, so I can click on that here shortly, proceed, and it should give you some additional information and resources on the rollout of the vaccination. Just keep in mind that the vaccinations is going to be based on availability, and it's a federal, state, county rollout. So it's critical that you guys are aware of what's going on in your community. Refer to reputable insurance carriers where to get your vaccination. You don't want to get hassled by a fraudulent vaccination company or person. So just let's start off with the two types of vaccinations that we're aware of and approved by the FDA. You have Pfizer, and then you also have Moderna. Moderna you take 1 month apart, and then the Pfizer you take it 3 weeks apart. And that is, again, based on availability. We've heard that there has been some delays in getting it. As long as you get it around that timeline, you should be okay. The other thing you want to keep in mind is that this corona vaccination, even though you get it, it doesn't 100% prevent you from getting the coronavirus again. It's so new out there. You hear percentages between the range. I think I've heard 70% or 90%. I don't know. Like you said, it's so new. Nobody really knows the actual effectiveness of these vaccinations, but it is available for you, and they've shared with public information. It's out there. It does offer you some protection. We just don't know exactly the true effectiveness of it. So that's the moral of the point there.
Yeah, at least we have some choices now. And again, I think it's a personal choice, whatever route you decide. Obviously, the CDC is still recommending that everybody wears a mask, that we're following social distancing, washing our hands regularly. Those are the types of things that everybody should be doing, regardless of what choice you make, until things start to flatten out, which I think, they are. But, yeah. We'll get into some myths and facts.
That sounds good. So I got it up here. I'll go ahead and start with we're going to kind of share this because we both love to talk. So I'll start off with the first myth and then fact. The first myth is that COVID-19 vaccinations were developed too quickly. They are not safe. Not true according to this Anthem flyer that's pulled from CDC. All this information that you'll see and that we're sharing with you is all pulled from the CDC. So the fact is the COVID-19 vaccinations were approved. They did go through their protocol testings, right? Studies, right? It's FDA approved. So just know that they are, according to CDC, safe for you.
Yeah, safe and effective is what the CDC guidelines say. So, the myth, I think, is that the vaccines were developed too quickly and that they aren't safe, but recommendations from CDC say otherwise. So,
yep. You want to take the second one?
The second big myth versus fact that we have is that the vaccines can infect me with COVID-19. That's the big myth. Now, the fact that the CDC indicates is that the vaccines cannot make you sick with COVID-19 because they do not contain the virus. You may have symptoms such as fever after the vaccination. This is normal. This means your body is responding to the vaccine by making antibodies, but it does not mean you have COVID-19. So that's the second big myth.
Myth. I will be completely immune to COVID-19 after I'm vaccinated. I think I've already touched on that. I think I jumped the gun, so I apologize here. But basically, it says no vaccination is 100% effective. It's so new. We know that it is high percentage effectiveness. We just don't know how effective it can be. So my only take on this, and you can add to this, is that if you do get the vaccination, doesn't mean that you can go walking around without your mask and not being careful,
Correct.
practicing social distancing.
Correct, yeah.
So I think that we still have to be careful.
The next myth we'll get into is I don't need to be vaccinated because I'm not at risk. The CDC recommends that as many eligible adults as possible be vaccinated regardless of their infection risk. Everyone needs protection against COVID-19, even young and healthy adults. If you've already had COVID-19, there is no guarantee that you will be infected again.
There's just always consult with your family doctor or a person that you have a lot of trust in that is in charge, a health professional that is in charge of your health. Because I've heard some stories about pregnant women, how it impacts them and how badly they get sick. Not sure what sort of side effects are with these vaccinations in pregnant women, but obviously just always consult with your family physician or somebody that you trust.
Absolutely. Consult with a doctor. Your personal physician is what we'd like to recommend, and the CDC does recommend as well.
So the next one I'll take, if that's okay, Tony.
Yep.
So it's the myth is I can be put on a priority list. I don't care. You cannot. That's a myth. Basically, the CDC with the federal government, with the state and county officials, they're all collectively working together to roll out these based on what they see as importance. As far as right now, I think here in the Kansas City area, 65 plus and high risk individuals like COPD, diabetes, those kind of underlying issues are being pushed to that first phase. But I think that what is the talk about the rollout here, according to Fauci and Biden administration? I think they said everyone's going to get vaccinated if they personally choose to do so by the end of April, but now that's been pushed back to the end of May. So
that's what we just heard today. Yep.
More to come. So
all we can do is try and stay up on the information. The priority for the vaccine list is not a matter of how much money you have or anything like that. It's based on your risk factor and what the local governments are doing, state by state, city by city, on rolling out the vaccine to their high-risk individuals first, and then working on the rest of the population.
Yep. Do you want to take the last one then?
The vaccines contain questionable substances. The FDA authorized COVID-19 vaccines do not contain fetal tissue implants, microchips, tracking devices, or anything that could change your DNA. The vaccines contain mRNA, which triggers the making of antibodies, then breaks down So that's the information that the CDC has put out, to try and eliminate some of these myth versus fact discussions that, a lot of folks are having.
Be careful even if you get vaccinated. Practice all those important things like social distancing, wearing a mask when you're out in crowds, and limiting crowds. I think that's the only thing that I have to add with all this myths and facts on the vaccinations.
That's right, Izzy. Everybody's got to do their part.
All right.
And we'll go ahead. So what we're going to talk about now is kind of circle back and talk about where to get the vaccine, where to get tested, what to do if you have original Medicare insurance, what to do if you have a Medicare Advantage plan, a supplement, and where to find those resources, which, we'll have links to all of our resources below in the video notes. And try, you can always email or call us, me or Izzy, if you need some more details, or if we don't have your insurance carrier posted on there, we'd be happy to point you in the right direction.
Yep. So as far as Medicare Advantage or Medicare Supplement or Original Medicare, if that's all you have with a standalone drug plan, or even if you're not insured, or if you have employer coverage, the way we understand it when it comes to COVID testing or COVID vaccinations, it's going to be provided to you by the federal government at no cost to you. So that's across the board as what we understand, with regardless of what carrier you're with, right? So
correct. And I do get the question a lot: are antibody tests covered? Yes, according to Medicare, that is part of the coverage as well. Because I've had some clients who've paid out of pocket for the antibody test, and
it's good to know
that is covered under the CARES Act. So you always want to be aware of all these testing treatments. Vaccinations is all 100% covered under CARES Act. The next step you have to figure out is who's going to pay for it initially. Are you just going to get the bill from the clinic or the hospital and try and sort that out with the CARES Act? Or are you going to go through your insurance carrier or directly through Medicare? One thing I'm kind of just recommending all my folks to do is just to go to the carrier resources if you're got a Medicare Advantage plan or Medicare Supplement plan, because then you won't have to get involved in all this billing and sorting that part out.
I was just getting ready to ask you that, Tony. I mean, you've had more clients than I have asking about this antibody testing. How did you get any of those resolved? I mean, did you get them all resolved? And
as far as I know, I haven't had anybody following up saying they had issues.
Okay, good.
So in doing my part by just telling them to go through the carrier to find the resources, where to get testing done and all that, I haven't had anybody come back saying that they've got any bills or anything like that.
That's good. That's good to know.
I think that's probably the best route to go, is just to use the carrier resources.
And if you are getting any questionable billing regarding antibodies or COVID testing, I think I've had this experience where a client of mine got billed for the COVID testing, or we really didn't completely understand the explanation of benefits from the carrier standpoint. But after discussing, we will get on the phone with the carrier with you, and we will question it for you if it needs to be that way as well. So, I mean, we're your advocates. We're here to help you understand the cost, the process, and most importantly, we are here for you. So, Tony, why don't you go ahead and take it away and talk about going back to the resources on. You're a Houston guy.
Yeah.
So I'll let you take it away here. So this is based
in my home zip code 77089.
Got it.
This is one of the resources. This is one of the carriers. This is a United Healthcare site. So you punch in your zip code, and then here's the resources. We got Harris County vaccine information, State of Texas health services, and then how to schedule. So Harris County vaccine wait list. Put yourself on the wait list. You can go to Walgreens, Walmart, CVS. And you also have an availability map. So that's one resource. This is United Healthcare's. Humana, Blue Cross Blue Shield, Anthem, and Aetna, they all have their own pages to where you can kind of find this information on testing, treatment, and how to get on the list.
So here's Humana's site about frequently FAQs regarding the vaccinations, treatment, testing, and different resources. So it's a little bit different, Phil, but what you'll see, the theme is very common. They all say that it is critically important for you to get with your health professional that you trust to know if you should get the vaccination, where to get it, and whatnot. So
talk to your doctor about what's
absolutely
best is kind of the common theme.
Yep. So they all have a different feel. Just wanted to kind of share with you Humana website so they don't feel like they're left out here. They got a hyperlink there that says COVID-19 testing locator to find a location near you.
Yeah.
Humana is a national carrier. They're pretty much all across the United States. So if you're a Humana member, we recommend that you go to their website, and they would have pertinent information for you regarding the COVID-19 and the vaccination. So
yeah, and Humana uses LabCorp as their vendor for running tests and things like that. Might be different for United Healthcare. That's why I say, if you don't want to avoid having to deal with getting reimbursed or submit billing and all that, your best bet is, if you have a Medicare Advantage or Medicare Supplement, go directly through the carrier's information for their testing facilities, because while everything's going to be covered under the CARE Act eventually, I think it's just going to be a lot easier to go through your carrier's resources for testing, treatment, and operations there.
I think that's a very good point there, Tony, because obviously the other common questions we ask, are they in the network? You brought up the lab company, LabCorp, to be part of Humana's network. So yeah, it's always important to go to the carrier's website to get the testing locations where you can get COVID testing or vaccinations, because then you don't have to worry about if they're in the network or not. So I think that's a very good point you pointed out there. This is just Aetna's site. I'll let Tony kind of walk you through it. It also has a similar feel. I mean, we're kind of expanding to the whole United States as far as with the different carriers. So
drop down, select your state, and then it's going to shoot out the information that you need for your area. If you're an Aetna member, if you don't feel, if you're not tech savvy, or you can't use internet or don't have internet access, just give them a call. Just call the number on the back of your insurance card.
Yep.
All that information is readily available.
Yep. And what I like to hear about Aetna here, I mean, there's all kinds of different resources, but Aetna is part of CVS Health. So, CVS, if they provide any sort of testing or vaccinations there, I think with Aetna, we feel comfortable that you can definitely go to any CVS all in the United States and be able to get those testings at no cost, or vaccination at no cost to you. The other thing you want to talk about, here's another hyperlink, access to telemedicine.
Yeah, telemedicine, that's popped up on the Google search with the virus, and Medicare is telehealth. I mean, very big thing. I mean, I got people still trying to set appointments and see their doctor and saying no, not for particular services. So telehealth is a big thing. Try and get used to it. I don't think, it's going away. I think, if anything, telemedicine is going to be, the way of the future. What's covered, your extra benefits as far as COVID testing goes, and mental health and well-being. I know we talked about that in one of our videos last year. I think mental health is still a challenge for a lot of folks during this time. Use your carrier resources. For me. Yeah. Use your carrier resources when it comes to your mental health. Yeah.
One thing that I just wanted to add on telemedicine, I think based on some of my clients, if with smartphones being very, very popular amongst millennials and Generation Xers and whatnot, I mean, they're even becoming more and more relevant and important to the senior population, because I mean, I've had folks that never had a smartphone in their whole life, and they're getting them at 75, 70. I mean, they're getting smartphones so they can keep in touch with family, with whether it be FaceTime, but they're also using it for telemedicine. I mean, they're talking with their healthcare professional right with their smartphone. So it's here to stay, basically, is what we have to say.
Yeah, absolutely. You want to get some good use out of that smartphone, and what better way to learn right now when everybody's still social distancing and lockdown, and
Yep.
you know, just get used to it, get acclimated with it, and familiar with how to use it.
Yep. And with that, we just want to say that we'll like to end this presentation that contact Tony or myself, Izzy. We'll have provided in this video our contact information. We are licensed in many different states throughout the United States. I think we'll put that in the video presentation as well. And contact us if you have any sort of questions regarding your Medicare coverage or even under 65.
Absolutely. Yep. We'll have our contact information below in the video. Links for our email and phone number will be included, and we appreciate you watching.
Thank you.